Hi everybody, Dr. Dawn April Ross of the Thought Word Academy, but today just coming to you as a woman who is trying to get pregnant again. So I just wanted to share with you a little bit of a longer video for those of you who are in the middle of your 2-week wait. I know that I am right now, and I am really just hungry for everyone else's videos to see what kind of symptoms they're having, what they're going through. I think we all go through this, and I think it's helpful to be able to commiserate with those who are going through the same thing, as well as to compare symptoms, because sometimes seeing that someone else may have something similar to us makes us feel like, maybe we're on the right track. So with that being said, transfer was 2 days ago. It was a 5-day transfer. The first day I didn't really feel much of anything. I was very exhausted and I passed out when we got home, but I think that was also because we had taken a very long trip to get there. We had to stay overnight. Excuse me. As I had mentioned in my earlier videos, I had done this Neupogen wash on Saturday, then I needed 2 days before the embryo was placed there. So that brought us to Monday. And then Monday we drove home. It was like about 4 hours to get home. And with the 18-month-old our daughter and pups, it was a very exhausting trip. So I don't know that that should really count as a symptom. However, I can say that I felt fine, just a little tiny bit of cramping, but nothing else, and maybe just having been from the procedure. Then the day after, Tuesday, which would have been DPO6, I did feel a little bit more cramping during the day, lower cramping, felt more like uterine cramping than it did like a period cramp. And as I said, I have been waiting, hoping that I would have that little pinch. It is a pinch that I felt when I had my ectopic pregnancy. It was a pinch that I felt when I was pregnant with my daughter. I've not felt it any other time. And for me, I believe that that is a symptom of the implanting. I looked up online, and there's the colloquial term for it, which is called lightning crotch, which doesn't sound lovely, but it is what it is, and it's something that can happen to women pregnant who have it much later on in second or third trimester, or even at the early pregnancy. I know for me, I believe that that's something that I have felt that was a sign for me. I recently watched a video on YouTube of a male doctor, who was saying that it was impossible to feel any symptoms of implantation because of the fact that the embryo is so very small. But I would not take the word of a man trying to explain what it's like to be in a woman's body. And I've watched enough videos, and through my IVF support of my clients that I work with, I know that that's not true. So there are some women who don't feel anything, and that's fine. You don't even have to have a symptom. It doesn't mean it didn't work. And there are other women who really do feel something. So I am happy to report that at 12:30 in the morning, which would have been this morning, I was up because my daughter was up, and I was in the kitchen and I felt it. Now I felt it lower than where I usually feel it, but I felt it, and that was really exciting for me. I hope it means what I think it means, but that was very, very exciting for me. Other than that, Tuesday was a pretty normal day. I didn't do any crazy exercise, much more low impact. I did my yoga, I ate my pineapple core, I've been drinking my raspberry leaf and nettle tea, and that's pretty much all I've been doing, and of course listening to positive affirmations as well. Trying my best to get sleep, to not think about it all the time, and to just be positive. So today is the second day past the transfer, which is DPO7. And again, if you've not seen my earlier videos, I take HCG booster shots. So every morning, I'm actually injecting myself with 25 units of HCG. So if I take an at-home pregnancy test, which of course I do, it's always going to come up positive because of the fact that I'm injecting it into my system. What I'm looking for when I test at home is to see that the line's getting darker. And if I see that line progression, then I know that my body is making the HCG. So today I did the really cheapy ones, the old dollar store, and I don't know if you can, I don't know if you can see that here. It's really very hard to get that line. All right, I don't think that's going to work. Maybe I'll just take a picture and I'll post it. Try the other one. I did 2 of them. Yeah, anyway, I don't think that's going to happen on this. So I'll take a picture. It is, I don't even know if it'll come up. It is the faintest of lines, but this is my baseline. This is where I know I'm starting from just the shots. So hopefully a couple days from now, it will continue to get darker and we'll see some progression. Now, I was reading an article that said that the implantation usually is 1 or 2 days after a 5-day blastocyst transfer, and then, I mean, the start of it, and then it takes a full 3 days. There's the starting, and there's the progression, and there's the completion. So what I felt this morning, which would have been the second day past, I don't know if that was the second day of it implanting or if it was the first day. So either way, even if it was, let's say, the first, then 1, 2, 3, then theoretically by Friday, the implantation should have been completed. And then by Saturday, there should be HCG that's more detectable, let's say, on the pregnancy test. Doesn't mean I won't test before. Of course I will, because that's what I do. I'm not saying it's right, but it's what I do. And that so Friday or Saturday, that will bring us to 5 days past transfer. And I actually am going for my beta 8 days past transfer, so not really a lot of time. It's only going to be 3 days after to discover it worked and what my beta numbers are. So anyway, other than that, on Tuesday I have to say I was ravenously hungry. I just ate and ate and ate. I couldn't stop eating. I don't know, again, if that was an actual symptom or if that was me just, I don't know, releasing from all the stress and just wanting to eat everything in sight. But I did eat a lot. That has diminished right now. I don't feel the same today. But that was, and I have tender breasts, but again, you know, we're injecting ourselves, well, I'm injecting myself with estrogen, maybe taking estrogen in some other format. I'm also taking the progesterone. I'm taking double what I usually take. So there's so many things that are going on hormonally that it's always hard to tell if the symptoms that we have are from the hormones that we're actually injecting ourselves or taking, or if the symptoms are because we're pregnant. So I can say though, since that little pinch, which I was so happy I felt, I've just had kind of on and off little cramps, you know, feels like uterine cramps during the day. I can say that, you know, I think that menstrual cramps tend to feel like they're a little higher up, and I think that uterine cramps feel like they're a little lower, you know, down where the uterus is. It doesn't feel as high. I think that for me is what feels different. But other than that, that's really the only thing that I have to report. I've seen a lot of videos out there with people who right away, you know, are getting positives and are losing their, you know, are gaining in their super smell. I mean, I don't know how it's possible, but, you know, everybody's body's different. So for those of you who are, you know, in your 2-week wait, that you're just days into it and you haven't been feeling much, or you're hoping to feel something, I can tell you, you know, I've been in that boat. I'm in it right now at this moment. There's really not a lot I have outside that one special pinch that for me, I think is a positive sign. Let's hope. I will continue to make more videos to share what's going on, and hopefully this is helpful. I know for me, watching these videos is always helpful because I feel that it lets me compare my symptoms and reminds me that I'm not the only one out there who's going through this. And it is a challenging time, you know, for all of us in the TTC community. It's hard. You know, there's a lot of loss, there's a lot of pain, there's a lot of struggle, there's a lot of desire for fortitude to persist and to continue on. And like I said, if there's any of you out there who have any questions, please feel free to write me here, or you can write me on my websites. I'll put it here below. I always offer a free 15-minute consultation if you want to talk about your journey or anything else that's stressing you out as a counselor. I'm happy to help in any way that I can, and you know, see how I can be of service. So thank you again for your time. Thank you for watching. I hope that you like and subscribe, and that this video has been helpful to you, and if so, that you'll share your thoughts, your comments, your questions, whatever. I'm happy to hear and help any way I can. And I'm really, really praying and wishing all of you to have much success, sending you all the wonderful sticky baby dust, and hoping that your dreams will come true soon. Take care, be well. Namaste.